Welcome to this edition of the COVID Ethics Update, a service of the Center for Practical Bioethics. Thank you for joining us. Today, our guest is Maggie Buckley, my friend and fellow board member of the pain community, and a person who lives with pain, chronic pain. Maggie, thanks so much for talking with us today. I'd like to explore with you how you're dealing with the realities of the pandemic and the impact it's having on your life, first and foremost, as a person who lives with pain. And then I'd like to explore, if we have time, your role as an advocate for those who live with pain. So first, I'd like you to tell us about yourself. You have the benefit or burden, it depends upon your perspective, of living with a variety of conditions. In fact, you could say that you've won the trifecta. You're a woman, you have a chronic condition, and you have a rare disease. Generally, when you use the word trifecta, that means a really good thing. You've won something. So tell us, how do you feel about this win?
Well, it could be considered a win in some perspectives, some viewpoints. My parents were always looking on the bright side of things, so they felt that this would be a good way to learn, and they used it as a learning tool. So at this point, I feel both rewarded and challenged because I've been given the opportunity to purposefully learn and research and continue to learn, and that motivation has been there. The challenges of having a rare disorder are that, especially this one, I have Ehlers-Danlos syndrome, or EDS, which comes with a myriad of comorbidities and odd symptoms, etc., that healthcare providers don't really understand because this is a multi-systemic condition. So the specialists in the healthcare arena always focus on what is their specialty, what symptoms relate to their specialty. And if they can address that or fix that one item, they figure, well, that's a win for them and for the patient. Unfortunately, with a rare disorder, multisystemic issues, that isn't always the case, because you address one issue, if you don't address it in the context of the whole person, the whole body, you sometimes can exacerbate other issues. So learning to advocate for myself and then eventually advocate for others has been a challenge. Learning the healthcare system, learning how to talk about things, learning which specialists to go seek out to get care. And since finding support organizations for EDS about 30 years ago, which was a very small community, I've met thousands of people from around the world that live with all the different types of EDS and other hypermobility spectrum disorders. So that's expanded my worldview as well. A rewarding part of that is feeling that I'm not alone. Wherever I go in the world, there's got to be somebody that deals with the same thing. And having a rare condition means that I've had to learn how to explain it to everybody, friends, colleagues, caregivers, coworkers, family, everyone. And I've learned a lot from those thousands of people that I've met around the world on how to do that, how to finesse that. As a woman, I don't always feel that the healthcare provider will fully listen and take the individual symptoms into consideration of me as a whole person, like I said. And oftentimes I feel that I'm being dismissed as being overly anxious, which is disconcerting because anxiety is a known symptom of one of the comorbidities, which is autonomic dysfunction. And so if a healthcare provider says, oh, this person's anxious, I need to get them over to counseling or to the psychiatry department, they're missing a whole range of really disruptive physical experiences that the patient is having.
So one of the tenets of bioethics is autonomy, the capacity to act upon our own independent thoughts and desires. You know, the way I look at it is the ability to have our own voice. And as a woman, that's really important. And as a woman who lives with pain, that voice is often not listened to. So you alluded to that a little bit, that your voice sometimes isn't heard as a woman. How has living with pain impacted that voice? And then how do you see the pandemic impacting that even further? How do you see it changing the paradigm? Especially because you live with a chronic pain condition.
Right. Pain is such a subjective experience. So there's no one size fits all treatment option for pain. And until I understood that, I felt that because I still experienced pain after receiving the treatments that were offered, that I was doing something wrong, or I was a bad patient, or I'd done something to increase my pain. And sometimes healthcare providers even told me that that was the case, and that I had to stop complaining, and they'd done everything they can. So with only pills and procedures offered by healthcare providers, I felt that I had little say in how my pain was assessed and addressed. Learning that there are treatment options beyond pills and procedures has meant that I've been empowered to try different things and to embrace what we refer to as comprehensive integrative pain management, or CIPM, as the gold standard approach to managing all types of pain. And a key piece of the CIPM puzzle is self-care and self-management, which gives me a sense of control over how my treatment plan progresses. I can communicate what I've tried that's worked, or what I would like to try that might be available as a referral, etc. And then coordinating with different healthcare providers that I interact with. Unfortunately, I'm the one who has to be the case manager for myself. And so autonomy is something that is available. There's a learning curve that needs to happen. There's an acceptance phase that you go through. I know that my pain will never completely go away, and I've accepted that. I can do a dozen things on any given day that will bring the pain level down. Each one brings the pain level down a little bit. So cumulatively, the pain is reduced, or the pain perception is reduced markedly if I'm able to put all of those things together. And for decades, people with pain and people with rare conditions have been asking for telehealth options, receiving healthcare. And with the current pandemic, suddenly there's barriers that have been there for these people for decades that have been removed because there's a pandemic and we don't have enough healthcare providers in the right place. So I'm hoping, fingers crossed, that some of those barriers will be reassessed as we go through this, and that better treatment will be available for people with pain, people with rare conditions, whose specialists are thousands of miles away. And an extension of that is that healthcare models are being forced to evolve and embrace alternative delivery methods, telephone, telehealth, video conferencing, etc. People sheltering at home is something that people with chronic health conditions are very familiar with. So they've always been asking for modified access to services and resources. And wouldn't it be great if those services and resources could be delivered directly to them in the home more effectively? And I'm thinking along the lines of nutritional counseling, which is an important part of it, movement therapy, whether it's physical therapy, Pilates, yoga, whatever. These people know, unfortunately, based on experience, they know how to navigate the healthcare system as it is. They know what they need and what they're asking for. They also know that they have to jump through hoops to get those things. So this population is an asset, an underappreciated asset in this time of pandemic. So people who are new to being sheltered at home or on lockdown or quarantine or whatever you want to call it, can reach out for help from people within this population. We can tell you how to manage your time. We can tell you how to pace yourself, etc.
I'm going to share that with our Pains KC group, that you, who they look up to as a mentor, have characterized them as an asset. They will love that. So
absolutely. So those are positive aspects. Some of the negatives that you consider is that many of us have learned how to adjust all the little things to allow us to keep moving forward in life. And when these little things are disrupted or removed, our well-being is threatened. And one example that it's all over the news is that people with lupus or rheumatoid arthritis aren't able to get their medications because of those medications being redirected without evidence-based research, just anecdotal and small opinion pieces from around the world that those particular medications are going to cure or manage or treat COVID-19 in some way. And that is just the tip of the iceberg, because people with rare conditions and chronic conditions, we have special needs that are nutritional, over-the-counter medications, etc. And those things are in short supply because everybody else is hoarding. So on a good day, as somebody who is celiac, going to the grocery store is a matter of making trade-offs and saying, well, they don't have the thing I know I can eat, so now I'm going to go read in detail all the labels of the alternatives and see if there's anything that might work. For over-the-counter medications, people with mast cell activation or immune system issues might have allergies to specific ingredients. So a medication as simple as Pepcid, which is an H2 blocker, which is part of the management protocol for mast cell activation syndrome. There's different formulations. Some of them have flavors, some of them are chewable, some of them have dyes, etc. But I guess everybody thought that they were going to have indigestion at home, so they just wiped out the supply of Pepcid out there in the market. And so now people with these chronic health conditions can't get it, or they'll find that it's available online for 3, 4, 5 times the cost in there. And the people who are hoarding these things don't seem to understand that this simple medication in its purest form, even trying to get it through prescription and pharmacy, there's shortage there. This is what allows people to eat. This is what allows people to lie down to sleep when they have GI disorders or genetic disorders or immune system problems. So specialty foods and ingredients that these people need to live are in short supply right now. And I, for one, don't appreciate everybody hoarding this stuff.
So the challenges and opportunities are really limitless, aren't they?
Yes, it's ongoing.
And when Maggie and I get together, we could talk all day, but unfortunately our time has come to an end. Maggie, thank you so much for talking with us. We appreciate all of you listening in and joining us for this edition of COVID Ethics Update, a service of the Center for Practical Bioethics. If you have questions, ideas, comments, or suggestions for future editions, we ask that you email us at covid@practicalbioethics.org. Please subscribe to the Center's YouTube channel and sign up to receive the COVID Ethics Update in your inbox at our website, practicalbioethics.org. Thank you once again for joining us. Please be safe and stay well. Thanks again, Maggie.
Thank you.